Hey guys, welcome to Renee's Nursing Academy, Nagarkoil. Hope you all are doing good, staying safe. So in this video, I'm gonna talk about a nursing management topic, which seems to me an important topic in your nursing management. Here we go. So the topic is legal issues in nursing. Okay. So here first, let me tell you what is law. Okay. So let me start with the definition. You can note it down. Law is the result of minimum level of shared values or ethics of a community of the people. Let me explain. That means it's simply a body of rules that will help to guide a human action. So you all know when there is nothing to control a human being, the human being can do anything. Say for an example, there's animals only having five senses, there is no rules, there is no laws, the animals can do anything, right? So for us it's not like that. We have a set of rules or we have a set of laws to be followed so that we can prevent some unwanted actions. That is generally called as law. So here in nursing there are some certain thoughts to be taken. So here we go. Here it is of two. One is intentional thoughts and another one is unintentional thoughts. In this video, I'm gonna explain about unintentional thoughts. So let me tell you what is unintentional thought. So unintentional thought is like certain action that was done by an accident, but at the same time, it will have a major problem on the other hand. In nursing, you can take that unintentional thought is when a nursing action can cause harm to the patient without any intent. Yes, the nurse will do something without any intention, the nurse will do something. Obviously, it will be an unknown thing only. But at the same time, on the other hand, the patient will be getting affected. That is generally called as unintentional thought. In unintentional thought, there are certain two topics to be followed or two things to be followed. So one is negligence and another one is malpractice. Here we go about this negligence. What is negligence? So the negligence is nothing but fails or forget. So both have the same meaning. When say for an example, the nurse will usually tell, right, sorry I forgot to do that, sorry I failed to do it. So that is generally called as negligence. If this act can cause a major problem on the patient side, that is generally termed as negligence. Let me explain in detail. If I given you an correct examples or suitable examples for this, you will get a clear knowledge. Say for an example, you can tell examples like fails to put side rails. You all know when your patient is having less GCS or if your patient is on sedations or your patient is on coma, it's mandatory to put your side rails for their safety precautions. Just think about it. The patient fell down from the bed due to improper locking of your side rails. When you're asking the nurse is telling, I'm really sorry. After feed, I just forgot to put the side rails. Do it is acceptable? No. That is why it is called as negligence or it is coming under unintentional thought. Even though the nurse done it by forgot or not in an intended way, the other side patient has a major problems like fracture or a small wound or something else. So this is generally called as negligence. I can give you some other examples like without explaining the adverse effects of an drug, they will give the drug. Say for an example, you all know when you give Daraflin, no, it will cause a massive itching all over the body. When the nurse is not giving it, when the nurse is not explaining anything and the nurse is giving it, what will happen? Obviously, on the other hand, the patient will get panic, right? So that you can take it. And others like fails to give examples. Say for an example, you can take digoxin. So you all know digoxin is one of an important drug for a patient with cardiac failure. The nurse forgets to give that drug. What will happen? So you can take that. And other like documentation. So these are all the general examples you can take under this negligence. Hope you understand this. Now the second one is about malpractice. The other name of malpractice is professional negligence. So you should be very clear about negligence and professional negligence. Let me explain. What is this professional negligence? It's very simple. Doing wrong. That's all. So you all know there will be a massive difference between fails or doing wrong. Okay. So let me give you an examples for this malpractice, like wrong medication. Say for example, it was clearly written on the drug card that Klaxon should be given in sub-Q route. Here you will give the drug in IV route. This is called as what? Malpractice. So it is totally a wrong thing, right? So you can take this. So wrong medication, then not responding to the patients when they are asking for help. Say for example, your patient is totally bedridden. The patient needs some assistance while walking. The patient is keep on calling the nurse. The nurse will intentionally just avoid that particular thing. What will happen? Obviously, the patient will try walking, they will fall down, they will end up with some injury. So you can take this as malpractice. Then another example is like performing some procedures without consent. So to some particular procedures, you all know it's mandatory to take consent, but here the nurse will not take it consent without informing doctor or anything. The nurse will directly do that procedure and end up with some problem. That is will be called as malpractice. And also during Ryle's tubes. So you all know Ryle's tube to be placed properly in the stomach and it should be checked properly. So here they will put it into the respiratory tract and they will start with, they will end up with some complications. So these are all generally called as malpractice. So this two thing will be coming under unintentional thoughts, which will be an main thing that will come under and legal issues in nursing. Hope this video is useful to you all. And if you need a detailed video about intentional thoughts, mention in comment so that we'll go for a next detailed video of intentional thoughts. Thank you so much.